So these are the 4 presenters today, and we're going to be talking about the challenges of facing with the transition use of transition use or young adult with intellectual and developmental disability transitioning into the adulthood. And I think most of all, we are focusing more on the research component, and also we actually talk about some of the intervention going on here. So, what does the transition means? And anyone chime in? Your own experience when you're transitioning into the adulthood?
Changing from one role, experience, stage in life.
Exactly. Thank you. So transition is actually, if in terms of the, the human development, well, especially we're actually focusing more on the adolescents or young adults. So they're actually, changing the life stage. So it's more, they live as a, children as a child and more having a protective life because there are like a family around, parents around, but moving into the more independent life, so which call it adulthood. So that is a transitioning, and it actually requires a lot of changes. And I think the transition age use, well, typically we are indicating the young adult between the age of 16 up to 24, but depending on the state, it can be a little narrow or broader. A lot of time it's it's a little bit different from state to state. But when you think about your own adolescence or like young adulthood, well, there's a lot of changes. And thinking about the human development perspective, well, physically you're getting taller, heavier, and also like your cognitive development is happening, and we are developing executive functioning more fully. And also, like emotionally, there's a lot of development, and a lot of time, the teenage, they are like kinds of become pretty moody in a day. They have like good day, they have bad days, and I had that moment, and it actually related their emotional development, and also it can be linked into the life crisis, and that is a time they actually develop the coping styles. So definitely, the emotional development is linked into the crisis and or stress and copings. And also family and social relationship. So especially when you think about the young adulthood, they are into the very intimate relationship, and also their social network has been a little different from when they're a child. So there's a lot of changes definitely going on, and also they prefer to go out and mingle with the friends rather than surrounded by families. That's actually typical. Some of the changes they have. And also work, in terms of the work, well, that is a time they're actually thinking about what they're going to do. Well, do they move into the college life or higher education, or maybe they want to look for another like part-time job, summer job, and what can be the full-time job they can get. So all those things, those thoughts are actually more the specific, and some of the career goals tend to be narrowed down. And when you ask the same question, what do you want to do? And maybe my 60-year-old daughter will say like, I want to be a USA, the American president. But when you ask the same question to the 17 years old, maybe it's not many people have the same answer like my 60-year-old daughter. So if you're thinking about those transition, these changes are often more difficult for young adults or youth with disability, including IDD population. And a lot of time they report they're facing more poor post-school outcome across the different life areas. And also maybe a lot of time there's a lot of concern about the sexuality and reproduction issues, and also identity formulation and emotional regulation came into the picture. And a lot of time the parents, they are having a hard time to deal with, I don't know what my child is looking for. There are more ups and downs, and it's actually creating like a daily hassle for entire family. And also career decision-wise, well, they're still in the school system, but they're not really prepared, and maybe parents do not really know what's out there after school. That is a greater concern because they don't really know what comes after school. And a lot of time, intimate, a relationship and social relationship, they are going through a more difficult time because there's a lot of time out group, in group, and they're forming those, in their own social network. A lot of time, children with disability, they're left out a lot of those, social grouping. So that actually creating more concern and creating more challenges for this population. In past 2 decades, there's a lot of emphasis goes into the transition youth, and they try to do a lot of initiative, but a lot of times still, the problem or issue has been persistent and remain unresolved. So a lot of time, it creates a lot of complexity for the IDD population. And I think we're going to talk about more specifically about the employment issues and the community integration and family issues. And a lot of time, it's actually they don't really know how to keep up with their independent living and situation or career option for after their school ends and their school system, they're out for the school system. So actually. Today, the purpose of this presentation is we want to examine and we want to explore what is the unique challenges among this population. And I think that it will be important because they are into the system and they are, a lot of time they're getting into the state VR system. Now I think that, it's more for us to think about what actually can help maybe, what we can help them to prepare better for their career and their independent life. So today, our outline of the presentation, we're going to talk more about the employment-specific issues related to young adult with the IDD, and we're going to move into the community integration and what is it going on in the sense of community, what's in there, what kinds of stigma issues among, within the community setting. And also, lastly, we're going to talk about the family and caregiver issues because a lot of time it falls to their families because they're still living with their family a lot of time, and actually parents are the one actually advocating for their child and exploring career option for their child. So it's a unique in a way. So we're going to talk about the family and caregiver issues as well. So now I think we're going to move into the employment section, which is going to be presented by Connie.
Hi. So I will focus on employment. Some of you may know that I have a background in occupational therapy. So I have worked with individuals with intellectual and developmental disabilities for almost 10 years. And from an OT background and now from a rehab counselor background, we all know employment is not just about a paycheck. It's more than that. So that really got me into looking at from a biopsychosocial perspective because my OT background really teach me a lot of the medical aspects, and my rehab counseling background really teach me about how a person can psychologically and socially adapt to an environment. So employment plays an important role. So based on a FIND survey, Family and Individual Needs for Disability Supports, about 85% of the families and individuals reported that they are not employed. So that is a very significant amount of unemployment rate. And even for those who are employed, you can see in the chart, the blue one is actually indicating people who are unemployed among the individual with IDD. I will just use the acronym. And then the orange one indicating the person is getting a regular job in a community setting. And then the yellow one is those who are in a facility-based employment in a shelter workshop. And the gray one is in self-employment or enclave type employment. So you can see the majority are still unemployed, and for those who are employed, over half of them are actually unemployed. So that is a really critical issue that we should focus on to improve the situation. So as I put it here, according to the survey, 52% of the respondents reported they are unable to find appropriate job training or assistance in order to help their children or the individual with IDD to find and keep a job. And according to the NLTS2, the National Longitudinal Transition Study, and it shows most of the people with IDD after they graduate from high school, their post-secondary education is pretty disappointing. Only 7.7% were attending a 4-year college, and 12.8% were attending a community college. In terms of employment rate, as we know, researchers, they have different perspective biases. So in this study, it indicates between 18 to 37% of them are actually employed. So it's still pretty low. And as EJ mentioned, large amount of them, majority of them actually continue to live with their parents after they exit the high school. So this tells us is falling short in employment. So the Rehab Act and now the RIOA, it tells us the importance of focusing more on the employment issue and also the pre-employment training for individuals with IDD. And annually, there has been $2.5 billion spent in VR state rehab agencies to provide services for people with different type of disabilities. And their goal is to help them to get job or maintain job, starting from the transition age. However, as you can see, some of the difficulties that have been reported is, first of all, is a long waiting list. Depending on the state, some of them have the selection of order, some of them they don't. And so in order for the individuals with IDD to get service, it's really hard. And I remember when I do one of the intervention studies that we do is to recruit people with autism to come in and receive some of the soft skills training. And during the intake screening interview, we asked them, do you know why you are here? And the answer that I was received is to determine how disabled I am. So they have to find different ways to answer questions, to fill out the testing in order to demonstrate how disabled they are. But we know that from rehab perspective, we always need to focus on their strength, what they can do in order to help them to maximize their function, rather than focusing on what they cannot do, what are the deficits. So it's kind of sad for me to hear it. And based on the ARC, they did the FIND survey. Actually, over 57% of the respondents are dissatisfied with the service that is currently provided by government-funded VR agencies. And 77% are dissatisfied with the amount of services that they can receive. And what about the privately funded program? Still, 53% dissatisfaction rate. So that gives us some information is how can we really improve and increase the satisfaction rate and also improve the employment rate of the population. So this is a study that I have conducted in a school district in Michigan. And the survey has a lot of other components, but this one I particularly extracted it for this presentation is one of the questions is asking about the employment-related support and services provided by the school district. That is answered by over 200 professionals in the school setting. And you can see this is a 5-point Likert scale, 1 to 5. And we asked them how frequently you provide employment-related services and how important you see this service for the students, transition students, from 16 to 26, because in Michigan we accommodate students up to 26-year-old, and how prepared you are in providing these kind of transition service. So you can see, remember the scale is from 1 to 5. 1 meaning very infrequent if we are looking at frequency. Or if we are looking at importance, very unimportant. And then one in the preparedness scale is very unprepared. So looking at the highest frequency, you can see is shaping appropriate behavioral skills or providing individualized support is still at the 2-point-some range. And then the next frequency level is about 1, this is 0 to 4, not 1 to 5. That's why we have the 0 point. And it's at the 1-point-some level is providing instruction on job skills building, providing employment readiness skills training, and collaboration among agencies, meaning collaboration with like folk rehab agencies and other agencies that provide related services. So from 0 to 5, they are only scoring 1. And then the next one is developing job seeker employment profile or conducting different kind of assessment or referring out for assessment. So looking at the frequency, the highest is only 2 in a 0 to 4. And then the lowest is only 0.73. So if we look at this from a transition professionals working with the transition population, this really demonstrates how much has been done in the school setting when we are talking about transition service to starting since they are 14. And then looking at the preparedness, most of them range from 1-point-some to 2-point-some. So how can we really, as an educator, as a practitioner, how can we really increase the preparedness and also the perceived importance? So you see the perceived importance is much higher than the frequency and the preparedness. So there's a gap. A lot of people perceive it's more important to do all these, but less people feel they're prepared or really implementing it in their day-to-day practice. So looking at some of the challenges, a lot of literature has shown it. I remember this morning, one of the presentation talked about we really need to go beyond admiring the problem. We really need to focus on how can we really solve the problem. So some of the factors that has been identified related to getting successful employment, including some of the challenging behavior, the social difficulties. Because we all know when we work, how many of you have worked since your first job that you do not need to interact with anybody? No. Because in our world, we have to work with people. So a lot of time the soft skills really get in their way rather than the job skills and hard skills. And the comorbidity, including, for example, anxiety, depression, or people with autism comorbid with intellectual disabilities, or the other way around, or people with autism with epilepsy or cerebral palsy. So all that will really increase the challenge for them to get successful employment. An educational level. And some of the external challenging factors, including employers' attitude. Yeah.
When you say educational level, you mean like reading level or how far they went to school?
How far they are in school. So for example, having a high school diploma would get them more likely to get a job than for those who are not having a high school diploma or in a curriculum, functional curriculum. So good question. So for external challenging factors, including employers' attitude, like stigma, no surprise, right? They have different kind of stigma towards people with IDD. And the vocational services that they receive, whether it's really tailored and meet their needs, or it's just a protocol that the counselors need to check the box. And receiving disability-related benefits. So this has been shown consistently in a lot of studies, is the person receiving Social Security benefits less likely to have a successful employment closure. And also the family socioeconomic status. So what does unemployment really mean to these, this population? It includes their social deficits may become even more severe because of the lack of interaction with people, low self-efficacy or confidence. No income, that means they may not have health benefits. Isolation, poor mental health, lack of independence, and eventually lack of quality of life. So here are some of the predictors for the post-secondary employment is inclusion in general education, taking different kind of occupational courses, having paid employment or work experience, receiving vocational education, and engaging in work study based on the research-based practices. And based on the promising practices, including the self-awareness of their own career goal or their career interest, the community experience, whether they have high school diploma status, interagency collaboration, family involvement, that EJ and Gloria are going to talk more about it. The family expectation, Gloria will be talking about it too. The self-efficacy, self-determination skills, independent living skills, social skills, peer support, transition program, and also their own autonomy. So we see there are a lot of predictors who actually tell us if we implement them appropriately or properly, it will help to increase the employment rate of the population. So some of the strategies that have demonstrated promising outcome, including the work experience that I just talked about, having students go through different kind of internship experience, including like project search, supported employment, receiving training and education, receiving high school education or university training or vocational training, seamless transition service, multidisciplinary collaboration. That include both teachers, transition coordinator, rehab counselors, parents, or caregivers. So, and then the next is family involvement, and the last one is assistive technology. So I just included these links right before this presentation because I just attended the presentation about NTEC, talking about all the different good information about transition. So I would highly encourage folks to go to the link because they review a lot of different studies looking at the promising and evidence-based research regarding transition. So how many of you attended this morning's session by Fong Chen? Okay, so I won't spend too much time on this slide because he already talked about it. It's a case control study looking at the effectiveness of supported employment among people with IDD. So the conclusion is using supported employment in this population is more effective than not using it. So I won't spend too much time on it. So receipt of supported employment was found to increase employment rates. And again, Social Security benefits, special education students and individuals with IDD or autism who are high school graduates tend to receive supported employment, are more likely to receive supported employment. This is a study, I'm going to show two studies that I conducted with my research team to demonstrate how important it is to customize or individualize the VR service that we provide to individuals with autism. So the first one is looking at the VR service patterns and outcomes based on the age group. So the first age group is transition youth who are below 18. And the second group is transition young adults who are 18 to 20, above 18 to 25. And then the last group is 26 or above. So you can see they're different colors because I work with the ASD population, so I like visual. So the first one I want to show is some of the predictors that we put into the statistical model is looking at whether there are certain factors would affect the employment outcome across the board, regardless how old they are. So we found there are a few. The first one is the demographics. If the person has work this incentive, receiving Social Security benefits. Across the board, it will decrease their likelihood of having a successful employment. And in terms of the service provision, it looks like across the board, regardless what ages are, rehab counseling and guidance, job placement assistance, and on-the-job support would really help them in improving their employment outcome. So if a person come in with ASD, the first thing I will look into is would these 3 services be available to them, because it looks like no matter what is going to help them. However, if we look at the blue, which means it's very age specific. So one thing that I want to highlight is for the youngest group, which is 18 or below, the education level at closure are very predictive in predicting the employment outcome. So in order to provide training to increase the education level would really help to improve the outcome. And it's not surprising for this group, having college, university training, occupational, vocational training, or on-the-job training would really help, but the effect is not as significant in other groups. So if a person come in who is 24, then my consideration of providing the university training or vocational training or on-the-job training would be different than somebody who's 17 who come in. Does that make sense? Okay. So another study is looking at the gender difference. So we know ASD, there's a big gender ratio, is 1 to 5. So I'm just interested in whether the person is a male with ASD versus a female with ASD. Should I provide different service, or it doesn't really matter the gender and I can provide the same service and getting the same outcome? And the study shows, again, the red one is across the board. We can, those are the ones that would be helpful to provide is job placement assistance and the job support. And then some of the predictors that is consistent across the 2 genders, including post-secondary education. Having post-secondary education really increased the odds of having positive employment outcome, and also pre-service employment status, which actually concur with what we talked about. Some of the predictors is the work experience while they're in school. So this is actually the article that both articles I actually co-author with some of our audience here. Mike Leahy, Sue P., and also Jennifer Sanchez. And then the blue one is the ones that is gender specific. So if a person that is a male with ASD, I would look into more about their co-occurring anxiety and depression symptoms, because that tells us it really would decrease their odds of getting employment. So looking at their mental health really is key. The other is rehab counseling and guidance and job search assistance. I want to point out job placement assistance and on-the-job support. When you look at the previous slides, these 2 are very important and consistent, no matter what ages they are or gender they are. So this is just a study summary. And then this is another study that is specific to cerebral palsy. And some of the significant findings are kind of similar to the ASD population, including the on-the-job support, job placement assistance, on-the-job training. So that tells us there is a certain pattern that we want to look into is those should really be seriously considered in providing for the clients when they have the IDD condition. All right. So here's so we know there are different evidence-based practice. Some of them are really evidence-based practice that has been shown in numerous studies. There is some research-based studies, practice. There are some promising practices depending on how you define it. And my curiosity is, okay, after knowing all these factors or predictors, they need to be used. They need to be implemented. Otherwise, there's no point for hundreds of articles being published and the practitioners are not really using it. So I conducted a study looking at all the professionals not all the professionals, but in the school settings, how they see themselves in carrying out evidence-based practice. What are some of the barriers? What are their confidence in doing it, and how would that increase their perceived readiness in doing that? Because that is actually a study after the one that I mentioned, looking at their preparedness. They're not feeling prepared. They're not feeling confident in doing it. So this study is looking at whether there's something that we can do in order to increase their readiness and confidence. So based on maybe it's a little fake, but based on what we have found is there are certain things that we can do as educator or researcher is to first increase their self-efficacy, providing training in different kind of modalities like webinar, in face-to-face, online platform, in order to help them to increase their confidence in carrying out or having the knowledge of evidence-based practice. The other one is to improve their attitude towards using evidence-based practice. Instead of thinking, oh, it's taking me so much time, I don't have the resources, my administrator are not really supporting it, we need to focus on educating them what are the benefits of using evidence-based practice. And finally is to help them to reduce some of the barriers. So these three factors would really lead to an increased use and readiness of evidence-based practice. All right, so there's some promising employment services that I have been getting to know more, and some of them I have been trying to replicating. One of those, two of those are actually done by researcher at Weizmann Center. One is called Transitioning Together for younger one who are 14 to 17, and then the other one is Working Together, is targeting the older adults who are 18 or above or below 25. So these two, they all focus on like teaching them some of teaching both of the training actually include the caregiver in the training. So what they do is to invite both the individuals attend the session, and in parallel, the caregiver would attend another session. So during the individual session, during the group session for the individuals with autism, this one is focusing on autism. They teach different kind of social skills, how to interact with people, and then for the caregiver, they teach them different resources in the community. So this has been showing some promising results. And then the other one is the Project Search. Even though Project Search has been existed for over 25 years, but not until recent 3 to 5 years, more research has been coming out. And I'm glad to announce that MSU actually is bringing Project Search to campus. And we would like to use the MSU little small community to teach the students how to navigate just simply by taking buses from one place to the other, or going to the cafeteria to order food and sitting down with different people and eating together. And we hope to, based on the project, that we can do some research and looking at how that would impact the attitude of the different supervisors working with the students on campus. How does that impact the attitude of the students, MSU students in general, interacting with people with disabilities? So I have to thank Mike for his phenomenal, excellent leadership in bringing the Project Search, because I have to tell you, MSU is one of the biggest institutions having Project Search, because in the past, Project Search has been implemented in hospital setting. So navigating in a university setting, getting approval from the president, from the provost, all the way to the union, having them on board are not an easy task. So finally, I just want to quickly talk about one of the ongoing intervention study that I have been conducting. We name it as ASSET. So there's assistive social skills and employment training, which really focus on work-related soft skills. And if you have seen in the literature, soft skills training has been proven to be one of the promising practice, but it really needs more research in bringing this from a level 3 or 4 to a level 2 evidence. So this program is an 8-week program, and the aim is to improve the participants' understanding about the soft skills and also the self-efficacy. And it's a 1 session per week for 8 weeks. Each one lasts for 90 minutes. So we have a group for the high school students coming to MSU, one of the residential hall, and we have a conference room hosting that session so that it doesn't look like a classroom. And it focuses on attitude, enthusiasm, teamwork, networking, communication, problem solving, critical thinking, and professionalism. And why we pick these topics, actually this program is modified from the skills to pay the bills that is developed by the ODEB, and is focused on the group process and in a conference room work setting instead of a classroom setting. And it based off from the social cognitive career theory is looking at the different environmental factors, the self-efficacy, the learning experience, and also some of the personal characteristics. How would that impact the outcome expectations and also the overall social and adaptive functioning? And this project, one of the uniqueness is it really is a multidisciplinary collaboration. It involves researchers from the school psychology, educational technology, rehab counseling, special education, and also the HR department. So we have people from the HR department who works really closely with company, looking at ADA, looking at how some of the incentives for employer hiring people with disabilities. So they're able to bring in HR personnel to come in and mock interview and critique resume with our students. And their perspective, I have to say, is totally different from my perspective because I come from a rehab background. And they are also able to bring in employers to come in and give talk and mock interview with students, including people from General Motors, Blue Cross Blue Shield, and other companies, because that helps us to know for these type of companies, what type of transition students or people with disabilities in general that they would like to hire, or what are some of the things that they would they would like to see in order for them to give them to create a position for them. And so here are just some of the findings that you can see, preliminary findings. Yep. So we see from time 1 to time 3, time 1 is right before the intervention, time 2 is after intervention, and time 3 is 3 months follow-up. So this, we have 17 participants completed the program in total. And it's nice to see the up when we see the functioning and self-efficacy, but after 3 months, we see a little drop. And I have been talking with different researchers, and they said, it's not a surprise for me, because if you just provide a training and we don't have a mechanism to keep them going, eventually they would drop. So this is something that I've been thinking is how can I really maintain it? But for the mental health, it shows it's actually the anxiety symptoms and depressive symptoms have been reduced. So here are just some qualitative findings. So I will just summarize it. Overall, it gives the participants a sense of belongings because of the group process that we use, and it gives them opportunity to learn about different kind of soft skills and importance of networking, importance of teamwork, and it also make them feel less stressed in terms of interacting with people or even applying for jobs. So I will hand that over to Nikki. To talk about community integration.
Yes. Okay. All right. I'm going to talk briefly about community integration because I know we've got a lot to get through today, but obviously employment's an important focus, so I'm glad we got to spend time on that. Community integration includes employment, so clearly overlaps, but there's a few other areas that I think also are important to address when we think about youth transitioning out of school. There's a lot more to life. Employment's a very important piece. It's also a mechanism to increase community involvement, engagement, and so forth. So community integration has sort of been a hot topic. It kind of aligns with community participation that we think a lot when we think of the World Health Organization's ICF model of conceptualizing disability. And what we know is for youth with intellectual and developmental disabilities, that unfortunately they're not as engaged in their communities as they would like to be, as they expect to be. And this is really something that's been concerning. So we have lots of data from NLTS, the National Longitudinal Transition Study, that shows individuals, particularly individuals with IDD, are not engaged in terms of employment, post-secondary education, but also just in terms of volunteer activities, other community organizations, just even hanging out with friends, a lot lower rates than even other youth with different different disabilities as well as non-disabled youth. We also know, like I said, I'm not going to talk too much about work, but a lot of times work, if people are working, it's in sheltered settings. Again, there is not a true community integration component oftentimes in those settings. Also, we know that in terms of social isolation, individuals with autism as well as intellectual disability are at risk for loneliness. We see this across the age range. And so if we can start making those connections prior to school ending, they'll be in a lot better place. A lot of young adults will stay in their communities where their peers may go off to post-secondary education. And although we're seeing more universities kind of look at having programs specifically designed for people with developmental disabilities, that's still not the common activity that a lot of individuals will end up getting. And so they'll be staying behind when a lot of peers are leaving. Connections they may have had in high school disappear. They're staying at home with families most of the time. We know that also community integration was sort of the impetus for really the whole deinstitutionalization movement. And so we do see people are more likely in their communities, like I said, higher rates of people living at home. But what is the quality of that? What is the sense of belonging? And so community integration really encompasses a lot of different aspects, including where are people living, what are they doing recreationally for leisure, relationships, how are they contributing, what's meaningful in their life, and also civic engagement. So again, I'm going to just highlight a few issues, especially for those of you who are working with this population or doing research in this area, to kind of think about what are, I think, some of the things we still need to figure out as a field. One is there's sort of a litany of terms that fall. We're using the word community integration, but it's oftentimes replaced with lots of different things. It's very frustrating trying to even do like lit reviews because you pull this up and what you're expecting to see, it looks like something else. And so as though I'm sure many of you are already familiar, we have that social inclusion, participation, engagement, belonging, connectedness. But what a lot of times, at least in my view, is a lot of times we're measuring community integration by physical presence or how frequent you're going into a community or going out shopping, and that oftentimes is lacking that sort of connected piece or sense of belonging. Do you feel part of your community? So, you may be in your community, but are you really of your community? Are you really participating? So there's a lot of issues about how do we measure this. And I think another really important piece that doesn't get talked about enough is what communities are important to us. We sort of think of this broad community integration, and we're often thinking of maybe the kind of physical community we're in. But if we really think about all the different communities that are important to us, there's lots of different ones, and different ones have different meaning to us. Maybe it's a religious community, maybe it's a neighborhood, maybe it's an employment setting. And so really trying to tap into how inclusion works in these different settings is important. I'm gonna go really fast. So again, just when we think about measurement issues, we can look at frequency measures, like how often you access your community. We can look at choice measures, so do you have the opportunity to go out if you want to? We can look at satisfaction measures, how satisfied are you with your experience in the community, with your friendships. And then we can look more at like psychological measures of do you feel connected and belonging. So again, it gets kind of messy then to try and tease out sort of an overall outcome measure in this area. But all these pieces are important. If you think about your own community integration and well-being, all these pieces have importance. So some of the factors that impact inclusion integration, again, as I just said, there are lots of different facets, but I'm going to lump them together. In terms of personal, really pretty few personal characteristics. We do see age. As people get older, they tend to report less community involvement among individuals with intellectual and developmental disabilities. Degree of disability, severity of disability is associated with lower levels. Also, social skills and challenging behaviors have been associated. You could probably argue some of that is environmentally caused too by what you've had access to develop. But we have a lot more environmental predictors of community integration. So residence type. We know that people who are living in smaller community-based settings tend to be more integrated in their communities than those in large facility or institutionalized settings. We know that if staff pays attention to helping promote people's choice and provides opportunities for choice, we see improved community integration. Transportation access is a huge barrier, so having that access. Getting participation in community-based experiences early on. We see this a lot with work. We know that early work-paid experiences while in school are more likely to lead to employment after school. I think another important thing to think about is the cognitive accessibility of information. I think there's a lot of people doing great work looking at technology, looking at assistive technology for cognitive disabilities, but I think that's still growing, and we need to think about, we're from Chicago, so I still don't know how to use, the bus schedule and all the new apps, and so how do we make that accessible to people so that transportation can be accessible? Family involvement. So some interventions, I would say just the takeaway message is there are some good interventions out there, but they tend to be small scale. So we really need to think about how to scale them up and see if they're working with different populations. We know that skill building and skill support programs do work in terms of building those social skills that are necessary for social relationships, but how do they really translate into different settings and contexts that isn't often always looked at? How can we include technology? There's been some interesting studies including like virtual spaces for people, particularly with autism, to sort of practice out social skills. So how can we continue to build on some of those? Again, not really widespread, but we're seeing them emerge. Peer-mediated support strategies, especially in school settings, so getting opportunities to kind of equalize partnerships between youth with disabilities and without disabilities, and to kind of promote meaning and contribution from all people are important. We see that more in school settings, so how can we translate that out of school? What are the long-term effects of those kinds of programs when people are actually transitioning out of school? There's data that changing the facility or system culture, so to promote choice and autonomy has been able to promote more community integration. We also know that kind of coming at it, not necessarily from always trying to fix the individual, but really how can we address the community issues? We know that stigma is a major issue. And a lot of it can come from a point of parentalism or benevolence of trying to protect individuals who are considered vulnerable, but how do we address that and kind of find that balance between having safe options, but also promoting autonomy and independence? So there's been a few studies sort of looking at how to go into congregations, into community organizations, and help them look at ways to make sure that they're inclusive to individuals with disabilities. And I think that's something that we need to see a lot more of. I'm going to skip some of the studies we have going on right now in the interest of time and just kind of get to a few of the gaps. So hopefully some of you guys, we can always chat more if people want to talk more. But really right now, we do have started some interventions, but we really need more well-documented interventions that are kind of more scaled up. We really need to understand how to best measure some of these concepts and make sure we're being clear with what we're measuring. Again, we want to move from sort of just counting community activities or presence in the community, but really looking at that belonging. I think some interesting things to look at like there's some people starting to look at social media that can really be a good facilitator of social relationships, especially if transportation is an issue. But at the same time, we also know there's lots of individuals who sit at home and play video games all day, and though there might be a social component, it could also be hindering that community integration. We really need to understand what's the preference of the individual, and I think this is why measuring community integration is so challenging. What's meaningful to that person? What communities are important to them? It's similar to trying to measure quality of life. It's hard to sort of capture that easy scale that's going to get at it, because we all, maybe my preference is to have 1 or 2 close friends. Connie's preference might be to have 20 really, 20 friends that she doesn't talk to as regularly. We all have different preferences. I might be scored differently than her if we were taking some kind of scale. So we need to kind of think about the nuances of that. Understanding the role of family. Again, like I talked about, sort of balancing the rights and safety of people with IDD, because it is a true concern. A lot of parents prefer sheltered or day programs for their student or their youth because they're perceived as safer, or they know where they're going to be. And so we need to really understand those and kind of find the right way to sort of address that desire for safety and protection, even though it may feel stigmatizing, and it can be stigmatizing. Look across, some states are doing really novel things. We need more research that's really looking at comparing states and programs, and what's working well in one state, can that be translated in other states? And also, like I said, it's kind of scaling up some of the strategies. There's some really interesting and novel intervention strategies that are being put out there, so just trying to scale that up. And once we actually have them, making sure people have access to them, because that's also an issue. There may be something great happening in another state, but is it happening here? How do we get it happening in our local communities? So I'm sorry that was really fast, but hopefully there's a little bit of time to talk about family. And I'm happy to talk with anyone more about community integration outside of this. We packed too much in here.
So family consideration, and I need to fly through some of the slides, and that way, Gloria there and get a chance, a few minutes to talk about her own, studies. I think the family is important, especially for dealing with, working with the children or young adults with IDD. And one of the things that when I work with the family and children with IDD, well, their mother always said, well, EJ, I have one wish, and what is that? I want to live one day longer than my child. And that actually shows that it's actually, they want to, they actually embracing those burden and also try to, protect their children. And that actually got me, interested in caregiving issues and caregivers issues and family issues. And of course, majority of, young adults with IDD population, they're living with the family members. And a lot of time, state agency, they don't really provide a lot of support for the family. And we call, a lot of time the caregiver as a hidden patient, because they're living there and they're suffering as much as they're, another family member with disability, but they don't really get to chance to, support themselves or maybe enjoying or maybe doing some other things. So I think that there's a lot of the research addressing the poor health outcome, mental health, physical health issues, and the lack of support and lack of knowledge about resources, because they don't really know what is the legal matter involved with those children with IDD population, and also after what is the future of their children. That is a huge issue and a huge concern for them. So I think that this is one of the things. I collected data from South Korea, and actually ongoing study here. Later I want to do some cross-cultural study about the IDD population, and especially their parental caregivers. And a lot of time they're suffering. They actually express a lot of concern, and they actually have carrying a lot of high burden, and they report a high rate of depression. And I think that this is one of the model I wanted to test it out. And the result, actually, we found the partial mediation effect related to dysfunctional coping mechanism. So once they actually, and also they actually, we found another, moderation effect related to, the relationship in between the stress and depression, and it actually can be moderated by the dysfunctional coping mechanism. So as you can see, if you actually have, you are actually having the same amount of stress, but if you have, if you're operating the dysfunctional coping mechanism, actually, you're going to have a lot, you're going to experience a higher rate of depression, like or complaining about the higher rate of depressive symptom. That is actually, you know, some of the things we may need to think about, like what kinds of coping mechanism they're, you know, using. And actually that's important because one of the things is there's a lot of high correlation. Your coping mechanism and coping strategy actually heavily influence, you know, to the person, children, especially IDD, the way they cope with the stress. So that is something I'm looking at it, and I think and another one is actually related to that. Well, within the IDD population, you know, parental caregiver with the autism spectrum disorder, they actually reported significantly higher depressive symptom compared with the, you know, intellectual disability or developmental disability group. So it's something to look into it, and I think I need to wrap it up so that way Gloria can get a chance to say something. Gloria.
Sure, is it my turn now?
1 minute.
1 minute, okay. All right, so thank you. What I might want to do is just to highlight some of the studies and that I have done in terms of what are some of the interesting findings as well as gaps that would be a take-home message for the audience to think about. So I apologize in advance, I won't be going in details, but you're welcome to go over the content and email me if we want to have more discussion. Would somebody help me to click the PowerPoint when I need to go to the next one, please?
Sure.
Okay. I suppose that's a yes. So the first study I want to highlight is it's a national online survey that that I've done with the Interactive Autism Network system, and this is actually a study that that we were able to collect about 194 caregivers of children and adults with ASD. And what we actually did try to measure it's on different psychosocial methods, including caregivers variables, caregiver burdens, coping, caregiver needs, and also quality of life. Now, in view of the time, what I want to highlight is that we're very excited that we're able to reach out to a national survey to reach out to parents of caregivers of children and adults with ASD. And the idea was that we hope to find out what are some of the unique needs of parents who are younger, children of younger, parents of individuals who are younger. But more importantly is the transition age. Individuals who are older, what are the needs for the individuals as well as the parents. But there's also another aspect that we are very interested in looking at would be what are some of the non-parents caregiver. Because as some of my colleagues have mentioned, as people, as they are aging, naturally, family and siblings especially would be the person who would be taking care of the family members with ASD or intellectual disability. Now, interestingly, even though we were able to get a pretty large sample size, I just want to highlight the fact that people who actually complete the survey still consist of 96% of parents. And also I want to highlight the last point is that although we have the intention to recruit caregivers of individuals who have adult children with ASD, we only have about 33% of those adults. Now, even though it could be a little bit disappointing because I think there's a lot of research that's actually in need in terms of looking at that. However, it's actually telling us a lot in terms of our future research as well. Next slide, please. So in this, what we find out is that there are definitely caregiver burden that is a huge predictor for caregivers who actually have negative behavioral outcome, including nutritional and healthy eating. However, when we look at whether caregiver burden mediated relationship, maladaptive coping, the way that they cope would mediate the relationship between burden and nutrition, we did not find anything that's significant. when we look at caregiver needs, we again find out that the unmet needs of caregivers substantially related to certain behavioral outcomes such as poor nutritional and dieting. However, this did not actually mediate the relationship between caregiver burden and also behavior outcome. Now, what it actually what this study, when we analyze the data further, is that when we look at the impacts of burden, we actually find out that what is significant is that there's an indirect effect on burden on mental health. However, none of any mediators actually have substantial results on physical health of individual. Next slide, please. So in this data set, we also try to tease out the comparison between the 129 caregivers of young children versus the 65 caregivers of adult children. And again, in the sake of time, what I want to point out is that consistently, caregiver burden are significantly different between parents of children as well as parents of adult children. Not surprisingly, caregivers of young children report higher burden in terms of school-related items such as temper tantrum, potty training. In this particular survey, we did not find any particular burden that was substantially higher in the adult children. However, birth groups actually report higher burdens and concerns when it comes to the child's ability to live independently and long-term coping in the future. When it comes to unmet needs, very similar. There are certain items that are actually predictable in terms of for parents of younger children. But what I really want to highlight is the very last point is that both groups report unmet needs for the future, the kids for the future in terms of the employment, services in the community, and romantic relationship. So what it really comes down to is that whether it is caregivers of adult children or young children, there may be unique needs and burdens and services need. They still look into the future where there's a lot of areas that needs attention, just as a lot of the areas that my colleagues have mentioned. Now, next slide. Now, in view of the fact that we did a quantitative study and we actually find out that we still are not able to find out what are the needs and challenges for caregivers of transition age children. We also take a different approach that we try to study parental involvement and expectations. And this is a collaboration between myself and another colleague and MSU. And we just also extended to collect data at another institution in Buffalo, New York. Now, this is a qualitative study where we try to look into the parental expectation and parental involvement in relations to the effects on the children of transition age and also the outcome for the parents. And so what we find out in the next slide, I would like to highlight the common themes. Is that there are low expectations for children, even though there's a lot of positive support and involvement with current school districts. Still, parents express a worry about 2 minutes. Okay. The future in terms of post-high school, things such as work, independent living, and the safety. They also mention consistently about the lack of knowledge and resources. And interestingly, they also mentioned about the fact that because they also caregivers who need to take care of their own parents, so they are really in an area where they are considered as sandwich caregivers. So they have to take care of their aging parents, but they are also taking care of their children. Financial strain and also the needs for more community support is also something that highlight in this study. So I do also want to highlight, let me just go to slide 58. So what it comes down to is there's still a lot of needs for what we need to do for family. And it was actually in my previous slide that we actually did a meta-analysis in looking at parent training and see how they would affect the parents and also children's outcome. And we consistently find out that parent training actually has a very large effect size on the reduction of children's negative behavioral outcome. It also has a moderate effect on the parents' practice in terms of the skills in managing their skills, the behavioral problems. However, when looking at parental stress and the mental health outcome, it has a very low impact in terms of parent training. Now, the reason why I actually find it very interesting in kind of questioning what is going on with that is because when we look at the psychiatric literature, in this slide, we highlight the intervention on family psychoeducation intervention. There has been a lot of evidence in supporting not only positive benefits for individuals with psychiatric disability, but also family. As in the very last slide point where it talks about the fact that it has reduction in terms of medical illnesses and the use of medical care for family, improving family well-being, greater family and knowledge and of their mental illnesses of their family members, as well as fewer feelings of stress and isolation. So in thinking about that, I really would like to encourage the audience to think about, okay, so there are evidence in showing that family education could make an impact on the family. But what is it that we need to do further in making sure that we can make an impact for this population of caregivers of transition age individuals? So in the next slide, I will not go over in details, but I just want to highlight that there are various youth transition programs. And I think the take-home message is that whether they actually have any effectiveness in showing the research, but also the fact that whether they actually have any direct involvement with family. Because a lot of them the interventions that's highlighted in here, the three programs, they don't really mention a lot about direct involvement with family. Now, the next two slides, I do want to bring some hope to the audience is that there are some promising evidence-based families psychoeducation intervention. Like what Connie mentioned, Weissman Center had a very good research on the transition together and also working together where they not only involve the person with IDD or disability, but also family involvement. The last slide, there's also Vanderbilt, the Kennedy Center also had a program that is also family oriented as well as a person with ASD oriented. And what I like about this program is that it also takes home of the element of advocacy, which is very strong in rehab counseling practice. So there are more details of those, and there's also the link that I would encourage the audience to go and look at it if you're interested. But what I really want to kind of draw to the conclusion is that there are elements that we can make interventions that are evidence-based, that are really tailored for family members, that could actually help individuals who have transition age students with IDD. So what I would like to do, 30 seconds? 10 seconds. Okay, so the conclusion is that when you look at employment, Connie had highlighted the fact that we need to have more services for that. There are a lot of good and promising work that's been done, but there needs to be more in terms of the connections between special education as well as post-education in terms of the VR system. For community intervention, what I would highlight in terms of the conclusion would be, again, there are a lot of activities and programs that really try to tailor for community integration. But the key that we want to take home is that do people really are just being in the community, or whether they really feel like they belong to the community? So that has got to be done a lot. Now, again, family and issues, I would skip that because we just talked about that briefly, that we need more services that really involve both people with disability as well as the caregivers, but also not to neglect that caregivers encompass not just parents, but siblings, legal guardians, as well as other types of non-traditional family unit. So in terms of clinical implication, there are a lot of wonderful things and services that are out there, but the evidence is still very sparse. And it is important to make sure that when working with this population, we include multi-domains, such as looking into services that help individuals and family in helping with their children in college, employment, independent living, and community integration. And true inclusion really needs to be looked into more in details rather than just merely the person is participating. And then family again plays an important part in their life in terms of the long-term support. So it is important to make sure that we also focus on that. Now, the very last slide in terms of the research implication, very similar to what we just talked about. There needs to be more evidence-based intervention for critical transition life domains that are in need for this population. And employment, there are some promising research. There are other aspects that need to be done in terms of more research work, such as social integration, independent living. Research on intervention for family and caregivers also lacking. And there's also research on interventions that address health and mental health needs for family are also needed. So I apologize for rushing through. The rest are references that we have, and I would turn it back to the audience. Yeah.
All right, thank you, Dr.